It just means pathology of, so lateral epicondylalgia or lateral epicondyle tendinopathy, something like that is fine. So Cosen's is a pain provocation test, so all we are doing, it gets a special name, but we are just shortening the extensor muscles and seeing if there's pain located back to the lateral epicondyle. So all I want you to do, position's good, good. I want you to lift up your wrist and then bring your wrist towards you. Good. So that's going to shorten the tendons, and all I'm going to do is push into flexion and ulnar deviation. Good. And we're looking, does she say ow, right along her lateral epicondyle where the tendon's attached to there.
You're shortening? You're lengthening?
Shortening.
You're causing it to contract.
Yeah.
Oh. Thought it was
That's
and then
good.
resisting.
Am I good? Did I say something?
She's resisting.
I
No,
feel like
was
there's
just
something
thinking
that
like it's
wasn't-
lengthening because like you're stretching it, but you said you're contracting it, so that's.
Yeah, she's contracting.
Okay.
The extensors, right?
Yeah.
Yeah, you're thinking flexors.
I think it
Yeah,
was-
I can feel
Yeah.
Oh, as long as I didn't misspeak, we're good. Misspoke, speak. As long as we're good. I'm stressing the extensors, so flexion, radial deviation, I'm pushing down and out. And looking for pain right there. Mills is the same concept, except now instead of instead of contracting in the shortened range, we are now lengthening the structures. So we need to straighten the elbow because they cross over to the epicondyle. We need to flex the wrist, and then we need to ulnarly deviate. And all we're doing is, does this passive stretch tension that lateral epicondyle? So one's contractile, the other is, well, passive, but I guess also to the contractile tissues. And last but not least, this one, I don't think this is too accurate, but they are commonly say through the extensor hoods that the muscles that you're going to focus on will attach to different segments. But what's the most commonly injured muscle for lateral epicondylalgia?
CRV.
And why is it the most common?
It's impinged up here.
Not impinged.
Or
Is it big or small?
small.
It's small, so the small guy gets hurt the worst, or the first. So hands out, good. ECRB goes to the third metacarpal. Metacarpal through the extensor hood goes to the third digit. So all we're doing is resisting the third digit extension, looking for pain up at that segment. That's it. What's that?
Wouldn't that be digitorum though?
Digitorum would be more of a full wrist flexion. They technically say that that helps to isolate that muscle, but I sincerely doubt that that's going to hurt, but then Cosen's wouldn't. So you just have to tie them all together. Now, even though these have special tests, special names, all we are doing are resisted tests. That's it. Different ranges, stressing the muscle, whether it's active or passive stretching.
And do you need to do like similarly for UCL? Like I know there's statistics on it, but when in doubt, do you usually need to do more than one?
Moving valgus stress test is your main screen for it.
Okay.
So you want to get a negative on that, rule it out. So
You want a negative, so you don't have to keep going.
Right.
Essentially. Okay.
Yep. So last but not least is extensor grip test. This is more, I would say, this is one of those special tests like scapular assist or scapular reposition where it can fall under the functional testing a little bit more. But basically it's looking at if we give the extensor tendon support, does that help her complaint of pain or weakness? So let's say we do Cosen's or just a simple wrist extension. So just lift up your wrist. Ow, or ow and it's weak, whatever it may be. We go to the extensor tendons. Just hold for a second. Okay. And all we're doing is compressing them down. And this is acting like a Chopat strap. And that basically, so that calms down the tendon, gives us some support. So once the tendon has support, pull, and then they complain of less pain and increased strength. So that's something where we know that there's some sort of muscle imbalance going on that we need to investigate. That's fine, but it's basically telling us that tendon is being stressed because these muscles are not working the way they should, so the tendon's getting excessive stress. For the short term, oh, you have to play tennis tonight for your team? Chopat strap to help you get through the match, but we know that we need to investigate these muscles further to go through the underlying cause for her issue.
Cause when the strap, cause like I was also prescribed that as like a kid for like tendonitis, so like that really, yeah, it's just a Band-Aid, essentially, like, can you do any damage by if someone swears by that and they use it all the time?
Usually they'll use it for sports all the time, and then they'll use it for everyday activities all the time, and then they can't take it off because it hurts and they depend on it,
That's what I'm wondering.
and it becomes a pain processing issue.
Okay.
Yep, anytime there's a brace or tape or something, you need to wean somebody off of it. It's a short-term solution. So that just helps guide our treatment and guide our examination and helps us with a short-term solution if we so desire. And that's it. I would say technically a biomechanical correction, you're focusing mostly on the joint. We will be doing those, but that's focused on the ulna. This is more of just affecting the muscle.
Stabilization?
It's in between.
It's a gray area.
Gray area,
Gray
that is exactly what it is,
stabilization.
because technically corrections, we're focusing on joints.
Okay.
Stabilization, we're focusing just on stability, where this is technically a correction at the muscle, but it's basically giving muscle support, but you're focusing mostly on the tendon. Found a loophole to our system, damn. But it basically shows that we do have some sort of muscle imbalance that we need to address. All right, before we just try these, one thing I forgot to show you or explain with that's something to be aware of. Lateral epicondylalgia is the most common elbow injury. So when you are doing your observation, if they complain of gripping, one thing you want to ask them to do is just show them how they grip. And what you want to see is, this is a common, you don't want to bring too much attention to it, but if you observe how they grip and they, just make a fist squeeze for me, how would you grip your tennis racket? You tell me if this is correct. What would you call this?
A bad punch.
That's a flexion give, it's a faulty movement, and that's very common when you have people with lateral epicondylalgia. They complain of gripping, you ask them to grip. Now maybe they grip, this is fine, yeah, it feels whatever, but then ask them to do whatever task, and maybe it's turn a doorknob, or grip their tennis racket, and now they're gripping like this and doing a backswing rather than a backswing. All those types of things you have to look at, but this is a common problem.
And is that
Eccentrically loads the lengthened tendon, causing excessive stress, injuries to the tendon. So just be aware during your observations, you're looking for faulty movement patterns, which you guys know.
Objective, baby.
All right, 5 minutes to practice Cozens, Maudleys, and Mills, and extensor grip, and then documentation, then home. Woo, 15 minutes.